We are getting started with our next session here. It's opportunities for advocacy with the Environmental Protection Agency and federal agencies. I'm introducing here Dr. Jerry Abraham. He is the Director and Chief Vaccinologist at CDU Kedron Mobile Street Medicine Program in Kedron, an acute psychiatric hospital, FQHC, and historically Black institution in South Los Angeles. He also serves as president of LA County Medical Association, a trustee of CMA, and counselor of the American Medical Association. Thank you, Dr. Abraham.
Hello, good morning, everybody. Excited to be here. We'll start by introducing our panelists today. We have with us Juanita Constible, like to join us. She's Senior Climate and Health Advocate at the Natural Resources Defense Council. Juanita helps advance climate adaptation solutions to the threats of extreme heat and other climate-related health hazards. Next, we have Dani Hupper. Dani is a climate advocate at Evergreen Action, leading their congressional and administrative outreach. Dani has worked on the Hill, where she covers climate change for a member of the House Ways and Means Committee. And Sara McTarnaghan. Sara is a senior researcher at the Urban Institute's Metropolitan Housing and Communities Policy Center. Sara's research focuses on climate change and resilience, immigrant inclusion and integration, and affordable housing. For complete bios on today's panelists, please see the meeting program. So administrative actions have significant impacts on regulating air pollution and greenhouse gas emissions. It's estimated that federal agencies, including the EPA and executive orders alone, could account for a 50% reduction in pollution and greenhouse gases by 2030. Excited to learn more about where to focus your climate health advocacy? Let's jump right in with the experts. All right, so hopefully everybody's got a mic, and we'll just share. And so the first question that we wanted to ask our panelists, really when we think of the health impacts of climate change, they're broad reaching. What are some of the main issues and intersections between health and climate and the work you're engaged in? We'll start with Juanita, and then we'll go to Dani and Sara.
This is perfect. Thank you, Jerry, and thanks to all of you for being here today. Before I get going, I do just want to do a quick unsung hero moment and thank Maya Abu-Zara, who's been up at the registration desk. She's been doing an incredible amount of work behind the scenes to make this conference a success. So I hope we can all just give her a real quick round of applause. Thank you. So folks who think of NRDC as just an environmental group are often surprised to know about how much we do on human health, but we have a long history of engaging in environmental health research and advocacy. When it comes to climate change, our work has mostly been on reducing emissions through changes in policies, programs, and investments. And those solutions, as you've already heard a bunch of times in the last 2 days, have an immediate health benefit in terms of reducing air pollution. And they help reduce those future impacts of climate change by keeping a cap on how much warming occurs. But we know that health harms are already happening now to people all across the country, all across the world, billions of dollars of health costs, human suffering galore. And so a small group of us at NRDC, including me, are also focused on climate adaptation. Those kinds of solutions are the things that help people right now deal with extreme heat, with drought, with wildfire, and the like. NRDC also does a lot of research on estimating the health costs of climate change, because right now, the $1 trillion figure, whatever it was that Senator Markey cited this morning, doesn't include things like emergency room visits and doctor visits and all the expensive treatments that are required to deal with health harms. And so we're trying to get a better handle on that. So when it comes to the kinds of regulations that we'll be talking about, the cost benefit analyses actually capture those. Thanks.
Great. Thanks, Juanita. Thanks again for having us. I'm so excited to be having this conversation. And I'm also delighted to be up with our partners at NRDC, who we've been doing a lot of this work with. So excited to be having this conversation with you. Also, Sara, really excited to be here. And it dawned on me as I was walking in, I totally forgot that I, many years ago, was a 4C intern at George Mason University. So I'm delighted to be back. So there are a lot of ways that the work that Evergreen does is at the intersection of climate and public health. There's a lot of ways, but I think today I want to talk about the 10 rules that Evergreen sees as the most critical to tackling pollution in the power sector. And those are the sort of climate pollutants, but those are also the traditional air and water pollutants. And without getting too in the weeds here, 2 of those 10 rules that we think are critical are the carbon standards for new and existing power plants that I'm going to talk a little bit about today. We see those rules as one of the most effective tools that the Biden administration has in their tool belt to tackle climate pollution. And of course, as we tackle climate pollution, we avoid public health risks later down the road that are exacerbated by a changing climate, like vector-borne diseases like heat exhaustion, et cetera. The remaining 8 of those rules are public health rules that I'm sure you all are very familiar with: the mercury and air toxics rule, the soot rule, the smog rule. These are all rules that will force laggard power plants to clean up their act to hit those new standards. And as they clean up their act, of course, that has public health benefits, but that also has the secondary benefit of reducing climate pollution. So I'll give you an example. The mercury and air toxics standard is a rule that tries to reduce the amount of mercury and arsenic released in the air, and EPA releases studies that show different abatement technologies to avoid releasing those toxins. EPA's own modeling shows that instead of installing that technology, they will instead, a lot of them will retire early. So that has both a carbon benefit and a benefit of reducing the toxins that are emitted. So there's a lot of different ways that there is key intersections between public health and climate, and that's just 2 of them. Over to you, Sarah.
Great. Thank you so much for the invitation to be here today. It's great to be in dialogue with people who have very different expertise than my own. I'm coming in as an urban planner and social scientist and working at the Urban Institute, which is a nonprofit research organization focused on social and economic outcomes. So much of my work when I attempt to link and understand climate change with health is informed by looking through 3 dynamics: the built environment, the natural environment, and social vulnerability. And so my colleagues in the climate and community practice at Urban are also mitigating these through looking at kind of place and the realities in different communities across the country. So just briefly on those 3 kind of pillars, from a built environment perspective, my work is concerned with what we build, where, with what materials, and importantly for whom. And this has involved working with cities and local governments to understand their own resilience planning and approaches, how they can plan and build in a way that adapts to climate change and generates co-benefits for health, whether that's improving air quality, mitigating urban heat island effect, or addressing disaster preparedness and recovery in a way that can mitigate and reduce mortality of such events. Similarly, from a natural environment perspective, understanding ecosystems and green infrastructure, and paying attention to changing patterns of weather and climate. Now, all of this is important to look through the lens of social vulnerability because the legacies and contemporary practices of segregation, social spatial exclusion of communities of color, immigrant communities, and low-income communities kind of map on to the many of the climate risks that we see today. Not perfectly and not exclusively, but many times the same maps reveal these practices. So it really calls attention to the need for an equity approach, understanding not only differential exposure to risks and hazards, but also to amenities and protections. So I won't endeavor to be the health expert in the room, but one reflection I wanted to share from qualitative research with frontline communities is the toll of mental health. And so just a call to action for all of us in the room today to pay attention to that as alongside other health factors.
Yeah, thank you for that, and lots of food for thought and for our advocacy efforts there. Another question for each of you. Following the passage of the Infrastructure Investment and Jobs Act and the Inflation Reduction Act, there are unprecedented federal dollars flowing and attention to climate change now more than ever being paid attention to. Where do we go from here, and why is it vital to engage now? And I'll let whoever wants to start, and hopefully we can hear from each of you.
Sorry about that. Okay, I can go first. So I'm glad you asked this question. This is one of the exact questions that NRDC and Evergreen set out to answer in our report. This report is called Powering Towards 100% Clean Power by 2035, and I suggest everybody here read it, but I can maybe save you the time and tell you what it says in the report. One of the multiple analyses show that the IRA will lead to about a 40% economy-wide reductions in carbon emissions by 2030. The president has committed to 50 to 52% economy-wide carbon emissions by 2030. That means that there's a 10 to 12% pollution gap that we need to fill in order to get on track to our carbon goals. Other reporting in that paper shows that if we move on these carbon standards at EPA and we move on the public health rules, we can get a lot of the way there to that goal, to the president's clean electricity goals. So that's why Evergreen thinks it's so important that we tackle these 10 power sector rules at EPA. Why is it vital to engage now? Well, a lot of these rules are not on schedule. A lot of them are delayed. In this analysis that Evergreen did, we showed that 2 out of those 10 rules that we're monitoring are on track and the rest are delayed. And this delayed, when these rules are delayed, that's a problem because it means that they are vulnerable to not being finalized in the president's first term, or they may be vulnerable to being repealed by the Congressional Review Act. So they're vulnerable in terms of timeline. And that's why it's vital to act, but it's also vital to act because this is kind of an exciting period at EPA where they're moving on a lot of these rules. A lot of the decisions are being made now. They're being proposed, they're being finalized. We expect movement on the carbon standards rule. We expect movement on the MATS rule, the coal ash rule, and I believe the startup shutdown and malfunction rule. And EPA just moved, I believe they made a proposal on a final rule on the good neighbor and the toxic water pollution rule. So the point being that a lot of these decisions are being made now, and so it's vital to act because for a lot of these rules, they won't be updated for several years. So timeline is important, but so is having your voice heard while these decisions are being made.
Yeah, I don't have a ton to add to that, other than there are opportunities beyond just reducing greenhouse gases pollution that also have to happen on a near-term basis. And Sarah's going to talk about this some, but one I just want to specifically highlight for this crowd is that public health and community health centers and healthcare facilities all across the country right now are trying to figure out how to prepare for more extreme weather and more disruptions to their ability to actually operate. And so one of the things that the administration should be doing, in addition to making sure that they're reducing future climate impacts, is to help those healthcare providers get the data, the technical support, and the funds they need to keep operating. Yeah, I'll turn it over to Sarah. Thanks.
Is that working? Great. So to complement the perspective on the kind of rules and regs, I also wanted to focus on the major programmatic dollars and investments coming out of the 2 bills. So they really move us in the direction of being able to address long-term issues related to climate change, especially how to plan, build, and support communities both to proactively mitigate and to adapt to the impacts of climate change. The bills certainly don't cover all of the bases that the research and IPCC reports tell us we need to do, and notably does not prevent expansion of fossil fuels, but it's a really important and unprecedented start. And so it deserves, in a lot of ways, the attention around this kind of generational, once-in-a-lifetime investment. So in kind of tracking the money and making sense of what this means, my colleagues at Urban and I are trying to focus on 3 questions: where it's spent, what it's spent on, and who does it benefit or harm. So just briefly on those 3 questions. On the first, it's important to note, as many of us probably know, it's a mix of just formula funding to states. A lot of the dollars are flowing that way, and we have to pay attention to different state political environments, but also to discretionary programs. And for the discretionary programs, we're seeing a lot of innovation and programs that have the promise to address really this intersection, this linkage between public health and climate change. But who can apply, who has the capacity and the resources to put together a compelling application to the relevant federal agencies for this is a big issue. There was a fantastic analysis of FEMA's BRIC initial round of funding that showed most resources went to well-resourced coastal communities, and many states with great need missed out on the opportunity. What is it spent on? Similarly, there's a lot of pressure to spend quickly, which means that we might fall into the trap of funding only business as usual projects that might not seize the opportunity for co-benefits in health and for people, planet, and economy. And so really excited by efforts to help communities plan, to get community input, and put together compelling applications, new ways of looking at cost benefit analysis that Juanita already mentioned, to make sure we're spending it on the right things. And lastly, who does it benefit and harm? I hope all of us are paying attention to Justice 40 initiative, which is a critical action taken by the White House and the administration to help direct these investments to frontline communities, to historically disadvantaged communities. As you likely are familiar, it requires 40% of the benefits, keynote benefits. How do we make sense of that to those communities? But there's still outstanding questions on how those communities are defined, what the enforcement mechanisms are for spending, and how to measure benefits. So there's been great progress. They just released version 2 of the CJEST, the Climate and Economic Justice Screening Tool, but advocates are continuing to call for more attention there. Back to you, Jerry.
Thank you so much. And last night, Jalan from the White House had mentioned actually several of the issues around Justice 40. So it's great to see that we're all kind of working in many ways and coordinating. This question specifically for the Natural Resources Defense Council and Evergreen Action. Regulations and federal standards are critical vehicles for ensuring health, and the EPA plays a critical role determining these standards. Can you address the why? Why are we discussing regs? And why is there a need for these federal standards? Are there specific regulations that you're following and that you want us to be aware of?
Sure. So in terms of the why, it's important to remember why EPA exists and why these other health protection agencies exist. They were built by Congress a long time ago, certainly, but they're here to carry out the laws of the land. And the laws of the land say that we're entitled to some clean air. So that's the very basic why. In terms of standards that we're tracking, certainly all the ones that Dani already mentioned, the two big ones being transportation and power plants. We expect EPA to be proposing standards for carbon dioxide emissions from power plants in April. And we really want those to be stringent enough to keep the power sector on track towards the president's 2030 goal. They've got to be finalized by early next year. And we know that's possible. Dani will talk a bit more about our report, but we have a roadmap to make it happen. On transportation, we're expecting model year 2027 standards anytime now, sometime in the next few weeks. There is no reason for EPA to be anything less than ambitious when it comes to these rules, because the marketplace is already shifting to electric vehicles. And the tax credits and the investments in the Inflation Reduction Act are going to make it possible to significantly expand the electric charging network and make it just cheaper and easier for people to buy electric vehicles. We're also tracking mercury and air toxics, the good neighbor rule. But I would say if you wanted to invest your time in the two most important rules, it'd be power plants and cars and trucks.
Thanks. And that's a good tee up for me. I can just sort of narrow in on the power sector stuff that Juanita was talking about. So like I mentioned earlier, we see the carbon standards at EPA for new and existing power plants as one of the most effective tools that the president has at tackling climate pollution in his first term. And in the report that Juanita mentioned between NRDC and Evergreen, it has modeling that shows that if you issue strong carbon standards, you can get to about a 76% clean grid by 2030. And the president has committed to getting to an 80% clean electricity by 2030. So that gets you significantly, a lot of the way there. And that's why we want these rules to be so strong, and we want to require substantial carbon reductions in that rule. And as you mentioned, that rule we expect to come out in maybe late April, early May, with a final rule in June of 2024, which does, put it sort of in the vulnerability around the Congressional Review Act. There is now sort of the boring stuff. There is a pre-regulatory docket that is open right now, so you can comment on that rule right now if you wanted. It's until March 27th, I believe. But of course, when that rule is proposed sometime in late April, early May, there will be a lot of opportunities to comment and testify. And that's the one that I think is incredibly important, encourage everybody in this room to engage in. Those remaining 8 rules that I talked about that are public health rules, the mercury and air toxics, the soot, the smog, we at Evergreen are prioritizing those rules. The MATS rule is, makes it so that requires certain power plants, particularly coal-fired power plants, to requires them to have release less mercury and arsenic. And they are coming out with what's called a MATS RTR, so a risk and technology review. That will be a study exploring all the technologies that are available for those power plants to not emit as much mercury and arsenic. I would look out for that report or for that study. That MATS RTR is supposed to drop sometime in late March, early April. And I highly suggest commenting. There's also the soot rule, which is also called PM 2.5. And that proposal was released recently by EPA, and it lowered the PM 2.5 annual health standard from 12 micrograms per cubic meter to between 9 and 10. And we think that proposal needs to be strengthened at a level no greater than 8 micrograms per cubic meter. And so that public comment period is open right now. I believe it closes March 27th, and I think a final rule is going to be in August. And then lastly, the soot rule. These may be, rules that you're also tracking, but the soot rule was just unfortunately delayed by EPA very recently by a full year. So the proposal and the final rule are now sort of vulnerable to not being finalized in the president's first term. And I highly suggest everybody here to let EPA know that it's of the utmost importance that they finalize that rule in the time that we have left. So that's a lot of dates and stuff, but good news is that Evergreen has a EPA report card that tracks all 10 of these rules and where they are in the rulemaking process. So I encourage everybody to take a look at that. If you can't capture that all in your brain, that's okay. There's a one-stop shop that you can take a look at.
Just wanted to actually ask one follow-up really quickly, since we're there right now. For many of us, thinking about administrative actions and executive orders is not really how we've always approached advocacy. We're often looking at legislation and approaching our legislators. But in this case, do you take into consideration court challenges or the success of such rules when we're putting these recommendations or testimony advocacy efforts forward? I'm guessing that we also need to be mindful of other ways that these rules could be impacted, including via judicial processes.
Oh, yeah, absolutely. You make a good point that rulemaking processes are not nearly as transparent as, say, legislation in Congress. They're much harder to watch, and taking a look at court rulings can also give us an indicator of what the strength of a rule might look like, or even the timeline of a rule.
Thank you.
And NRDC, for folks who don't know, was formed by lawyers. We are constantly keeping that potential litigation challenge in mind and working on that proactively, because it'll come.
And you know how much health professionals love trial attorneys. So, but we know that there's a lot of work for us to do, both within medicine and the legal field. Specifically for the Urban Institute, Sara, beyond the EPA, which other agencies are tasked with addressing climate impacts? What federal actions should the audience be paying attention to within those agencies?
Great, thank you. Luckily, the accurate answer to that is all of them after the president's executive order addressing the climate crisis at home and abroad. But let me speak to a few that are critical to my work in community development. So HUD, FEMA, DOT, and the human services side of HHS, which might be less familiar for you all in your day-to-day work. So just honing in on HUD for a second. Housing is so influential to many of the ways that health intersects with climate. So I like to think of housing as a form of medicine, as a prescription that can be offered that can help people be more safe and secure and healthy. So while we won't go into a whole spiel on the state of affordable housing in the country, but we already know about the shortages and the high costs, and that's really being threatened under climate change, both disasters that might take units off of the market, and also the need to green retrofit and make homes that are responsive to the dynamics people are facing. While HUD doesn't have purview over the nation's entire housing stock, it is really influential on housing for our most low-income neighbors. So there's some historic programs that are at play here, but really exciting new efforts. The Green and Resilient Housing Program is a new program that will be supported through these bills. There's a public comment period. I think it might maybe just ended, but encourage people to review public comment and keep communicating with regional and DC-based HUD counterparts on priorities. They're really looking to build this program from the ground up and trying to get a cross-sector perspective. They also just launched a new Office of Disaster Recovery and Resilience, which is a critical way for them to be thinking long-term about what their housing stock, HUD-owned and HUD-supported housing stock needs to look like. On the topic of disasters, FEMA's disaster mitigation and recovery programs have the potential to do a lot more to address health risks and healthcare infrastructure resilience and targeted needs before and after disaster. The agency slowly but surely has a few more tools to do more on the mitigation and preparedness side, not just recovery. So excited about the Safeguarding Tomorrow revolving loan fund, the Building Resilient Infrastructure and Communities BRIC program, and expanded flood mitigation program. So as you all are doing local work or connecting to people at the state level, there's opportunities to think about how your states are responding to those competitive programs and thinking through those opportunities with the health lens. Just finally want to mention the human services side of HHS. We're doing work together with their research office to build tools to help TANF and Head Start program providers better understand the environmental justice and health risks that their communities face. And so in responding to that executive order, they're thinking about how their existing programs, right? It's not just all about the new programs, but how the existing programs and their footprint across the country can really help communities address these risks. And a lot of that involves capacity building and relearning from the ground up for social service providers.
Just wanted to offer Juanita and Dani an opportunity if y'all had any other recommendations as well.
So the agency I want to focus on is Department of Labor, which is not one most people think of as being a climate agency. But I don't know if you've seen in the news, there's actually a labor shortage when it comes to clean energy workers. So DOL has a really important opportunity to help train workers for this new clean energy economy, and in specifically train workers in communities that are transitioning away from fossil fuels, like in Appalachia, or in communities of color where there have not been traditionally the same kind of energy job opportunities as for whiter communities. Also, OSHA, which is within DOL, recently started a rulemaking to protect workers from heat. Workers right now all across the country are underprotected or not protected at all from extreme heat. And as the temperature climbs, as heat waves get more severe and more frequent, that problem is going to become even worse. So OSHA isn't seeing this as a climate adaptation policy, but I very much do see it as that. And it's important to note that in the US, occupational segregation is still a huge problem, particularly when it comes to low wage and dangerous jobs, which means that Black and Brown communities are currently bearing that burden of extreme heat. And the economic losses that I alluded to earlier of having to deal with, say, on-the-job heat problems that aren't covered by workers' comp are borne by those communities and are a barrier to building wealth. So consider this a standing invitation to come talk to me about extreme heat and OSHA if you want to lend your voice to that effort.
Thanks. The only one I would add is probably making sure you're keeping your eyes on FERC, the Federal Energy Regulatory Commission. I would just flag two rules, one of which is the regional and interregional transmission planning rule, which will reform how regions plan their transmission planning to take into account a minimum set of benefits, and some of those benefits are public health related. And then I would also pay attention to the interconnection rule at FERC, which will help streamline projects and make sure that they can get connected to the grid faster. And that's a big bottleneck for a lot of clean energy projects, which is waiting on the queue and not having a chance to get online. So hard to add to the robust answer of my colleagues, but I would say those two.
Yes. Okay. So big deep breath, everyone. I know that was a lot of information, and now we're wondering, what am I supposed to do? So can you give us some specific recommendations on exactly how we can engage in advocacy around these federal standards and to not feel so overwhelmed, especially when some of us or many of us may not actually be technically trained or fully understand some of the science behind the recommendations you are making.
I can go first on this one. So I would say, despite the fact that we just threw an alphabet soup of acronyms at you and hopefully did our best to define most of them, you're so well positioned to do this. And just want to lift up three ways to think about that. So first, just bringing the evidence to bear, both through your professional training and your day-to-day work. You have so much insight on the impacts and are observing that in real time. And so making sure you're sharing that back. Also lifting up the communities you serve, right? In another phase of my work, I do a lot of work on immigrant integration, and time again in our surveys, doctors and medical professionals came up as some of the most trusted providers of information around, at that time we were studying public charge, but just recognizing that trusted role you have in communities and holding that carefully and cautiously on these important issues. And then finally, helping to build the case on benefits and harms of actions or missed inaction, right? And so we won't get into all cost benefit analysis today, but for so long, we've just been doing a plus and minus of costs and economic gains. But if we can move towards building in long-term health impacts or potential health costs, I really think we can start to make the case for more holistic resilience interventions. And I think the medical profession has a lot to offer there. Just speaking personally, I work at a nonprofit research 501c3 organization. We don't necessarily think of our role always as advocates, but we're learning more and more how to sharpen our evidence and make that accessible to policymakers. And so that might look like a public comment. I had the opportunity to take some of my research experience and public comment on the climate and economic justice screening tool, calling attention to the fact that the omission of race in the tool was a critical concern due to the long evidence of connections between environmental justice and racial segregation. There's testimony, but there's also just kind of more broadly informing the public via media engagements, digital storytelling, and just really, again, focusing on that translation piece.
Juanita, did you want to add?
Yeah, I'd be happy to add. This is kind of the million-dollar question, right? How do we be effective advocates here? And I want to offer some like spicy one sentence. Here's your homework, what you should do to be an effective advocate. But I really think the best answer is to just stay on top of these rules as much as you can. It is so critical to know where it is so critical to know where in the sort of bureaucratic journey a rule is so that you know where to best intervene and how to best intervene. So some questions to ask yourself, as Sara was alluding to, is like, is this rule, are we waiting for a proposal? Are we waiting for a final rule? Is there a comment period open? Can I testify? And can I know those dates as early ahead of time so I can alert my community and my network that those opportunities to comment and give my feedback are coming up? Then there's also the question of, if the rule has been proposed, do I think that that rule is strong? Does it need to be strengthened? And of course, as public health advocates, you are so uniquely suited to be able to answer that question and also be a good messenger in giving that feedback, pointing to that important research or evidence or data that the EPA needs to strengthen that standard. And then sometimes it's not a question of substance or, whether the standard needs to be strengthened. It's a question of timeline. Is the timeline that EPA or whatever agency has proposed fast enough to be finished in the president's first term? Then the sort of call to action would be showing EPA that you're concerned about this timeline and asking them what sort of resources and support they need to expedite that timeline. So, I guess the sort of natural follow-up question is, how do you follow these rules? That's also a hard question, and one that is a lot of my job, and I think it's hard to follow all these rules. So I don't have a easy answer, but one, I invite you to join Evergreen's coalition calls, where we sort of swap intel and crowdsource this information. There's also the White House puts out something called the Unified Agenda, which is basically an update on the timeline of several rules across the whole administration. So not just EPA. So you can, the Unified Agenda comes out once every 6 months. So when it comes out, you can look at it, see, hey, has this rule been delayed or is it on time? We also just sort of follow Inside EPA, which is a, outlet that follows and tracks these things, or even something as silly as putting like a news alert on your phone so that when something is updated, you can get that information. But, I think following these rules and knowing where they are in sort of this bureaucratic journey that I'm talking about is so important in knowing like when and how to best intervene. And I know it's a laborious thing to do, but that's my big suggestion.
And I try to go on the calls so I can tell you guys.
Ev's little picture lurks on the side.
One other way to keep track of the administrative process is you can actually subscribe to specific rules and specific agencies within the regulations.gov website. That's really in the weeds, but if you're there. And remember that groups like ours exist to help group advocates like you do your thing. So if you're looking for technical advice, if you don't have to be the experts on the nitty gritty of a rule, come talk to us. But the thing I want to reinforce is just the absolute critical importance of stories. Industry has all these paid flacks that are out there saying rules aren't important. We don't need them. They're too expensive. Wreck the economy, blah, 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 blah. Your passion, your credentials, your firsthand accounts of people that are being affected by heat, affected by wildfire smoke, affected by flooding, that is worth so much more and can be a really powerful direct rebuttal to what they have to say. So keep that storytelling going. And remember that the overall public narrative is sometimes just as important as the really technical comments to EPA.
Great. Hopefully you're all feeling fired up and ready to influence the rules making process. Why don't we go ahead and open it up to our audience members, both here in the room and I know also on Zoom, and we'll alternate between what we're getting in online as well as for those here. Why don't we start here in the room? Let's see.
Hi, my name's Erica. I'm a nurse practitioner in Virginia, and I have submitted comments from time to time on federal things, but hearing you talk, I think to me it really reinforces we kind of need to be spoon-fed this stuff. Like I am not going to be following FERC, EPA, OSHA, and so I think that an incredibly valuable resource that these policy organizations could do is just put together an email list that would kind of spoon feed, like, this is what it is. These are the points we'd like you to make. Here's the link for the comment. Because I think that what I'm hearing described is a really big ask and that an incredibly valuable resource would just be, a unified heads up. So I just wanted to put that out there, if that's something you might be able to put together.
Thank you. Didn't know if anybody wanted to comment on that, and we can also look at the next question.
Sure, I can quickly. So if you sign up on NRDC as someone who's interested in taking action, you will get action alerts that say, this is happening right now, submit a comment, here's some brief text. That's a starting place. We also have some fancy behind the scenes stuff that I don't really understand, that once you take a few actions, it ups you into a new category that's like, here, you might want to do this more complicated action. So that's one way of doing it. Most advocacy groups have something like that. And then, of course, there's your resource.
Yeah, I really appreciate that feedback because you're so right. You're like, how in the world could you possibly track all of these rules, when to comment, how to comment, what to say? I'd love to give you this report if that's okay. It has sort of a graph that shows where, this rule is delayed further, this rule has no action, this rule is on track. So what sort of where it is in the rulemaking process. And then good thing I printed it out. Has more information about like the timeline of it, when it was proposed, when it was delayed, how much time it was delayed by, when the new timeline is, and when the final rule is, and then a little paragraph about the sort of public health implications. So I'm hoping that can provide a little bit of a resource for the purposes of your feedback, but I totally hear you that it needs to be spoon-fed.
And just also to underscore that while there's probably a role for your expertise in so many of these organizations, like the consortium can also be helpful in thinking about when is there a critical health perspective that needs to be brought here. And so just wanted to uplift that there are other people, other networks of professionals that will also be responding on some of the industry specific, some of the, is this even feasible? But when there really is a perspective that is uniquely yours, just encouraging everyone to seize that moment and to rely on networks like the one that you're already engaged in to help identify those opportunities as well.
Wonderful. And who needs business cards when you can actually just hand people your white paper or your research with your name on it? What an awesome trademark. So let's take a question from Zoom.
Okay, we have a question from Jean. They ask, are we afraid that 40% of the funding to historically disadvantaged communities might benefit those at the policy stage, not necessarily those from those communities?
Short answer, yes. Concerned about a lot of the ways in which we actually put teeth behind the Justice 40 rule. Much of the attention has been focused to date on how do we paint the map of the United States to show which jurisdictions are eligible. This is really important, but we know that a project located in a jurisdiction doesn't necessarily help everyone in that jurisdiction equally. And so I think, again, a lot more advocacy for accountability around Justice 40 is helpful. And that really is, I think, from the local level up. So just, yeah, calling for folks to be engaged in tracking and accountability and lifting up when you see that isn't playing out right. I think to the question of is it policy or program, I'm curious how we think about some of the rules from the perspective of Justice 42. I'm thinking much more on the kind of program dollars and brick and mortar investments, but I wonder if anything else in the policy sphere, if we look through the lens of Justice 40, if we look differently.
I usually think about it in terms of the money.
All right, why don't we take a question from here in the room? If you could introduce yourself and then ask your question.
Sure. I'm Christine Berg, and I'm an oncologist from Maryland. My question is to add to the mix of other federal agencies is the Department of Energy. I just looked up the Inflation Reduction Act is providing $2.8 billion for improving transmission across the U.S., which is critically important to get these renewable energy transmitted to where it's needed. So what are there pending rules that are coming along for that, or, you know, any advice?
Anyone want to tackle that one?
Yeah, you're totally right that there is a lot of IRA money for transmission, and that's absolutely key. We need to make sure that that grant funding is implemented effectively and efficiently. In terms of transmission rules or regulations to follow, I would, not sound like a broken record, but talk about the important rules at FERC, the Federal Energy Regulatory Commission. So both the importance of implementing that DOE money, but also making sure that we follow the interregional and regional transmission rules that reform how regional planners take into consideration a minimum set of benefits, including public health rules and these interconnection rules that will help get clean energy projects on the grid. So we like to say at Evergreen, there's no transition without transmission. It's kitschy, but it works. And so agree with you absolutely there.
Wonderful. All right, we've got about 7 minutes left, and so we're just going to continue to alternate, and hopefully we'll get through the next 5 or 6 questions. So everybody's standing. Do you want to go ahead and ask the next Zoom question?
Yes, we have a question for Juanita. Could you, from Linda Rudolph, I believe this is Dr. Linda Rudolph again, but so the question is, could you talk about how you connect the work on community climate resilience with the policy advocacy around EPA regulations?
It was specifically for me.
Yes.
So full disclosure, I don't actually work directly on EPA rules most of the time. However, I do have colleagues in our new energy equity. Wait, I always mess up the name. Our new equity center within NRDC that is looking at how EPA investments from the Inflation Reduction Act are being distributed to communities. So there's this whole big section of community and climate justice and environmental justice community block grants. And EPA is just designing that program now. So they just closed a public comment period on that. Again, it's a question of who gets the money for what. So they're asking really basic questions at EPA right now about what kinds of projects should we even fund? Like that's the kind of level we're at. So in terms of the greenhouse gas reductions, I'm less familiar with how to connect that specifically with communities. Dani, I don't know if you have any.
Dani, did you want to add anything, or Sarah?
No, only thing I would add is I think the EJ, my understanding is the EJ block grants, the comment period is still open, I think. The RFI is, I think it got moved from March 17th, I believe, till later in the month. So that's my own little stupid update.
Thanks so much for being here. Thanks for all of the work that you're doing. And it really resonated with me hearing my colleague talk about the challenges for an individual healthcare worker to try to keep up with this detail. And, that's on my mind as well, knowing not everybody here are physicians, but the data shows 1 in 5 physicians are planning on leaving practice related to burnout and moral injury and moral distress. And I am hopeful that by addressing some of the things that you're doing, that we can keep people both through their advocacy, but because they feel a little bit less powerless to take care of the things that are affecting the patients, that we can help people in the profession. I'm also struck by that Dr. Abraham is the president-elect of a county medical society. I wonder if I could hear from people about, and from all of you, about what are the opportunities for county medical societies, state medical societies, professional societies to intersect and to join together with the work that you're doing, so that the people who maybe aren't experts in this area can learn from the people who are the experts in the area by working with the people who are doing the work.
By the way, could you introduce yourself real quick?
Oh, sure. Yeah, I'm Eileen Barrett. I practice internal medicine in the Navajo Nation.
Wonderful. And I believe you're one of the AMA Equity and Medical Justice Fellows. Is that
I
correct?
didn't know you recognized me with my mask.
Tried.
I just finished being a medical justice and advocacy fellow with AMA in
Congratulations.
Morehouse. Thanks.
Wonderful. All right. So anybody want to take that away? It seems like we've got a lot of different groups and stakeholders, and we've got to figure out how to bridge it. Any advice for us? While you'll think about that, I will just say, so yes, as an organized medicine junkie, I think one of the challenges we face is we've been so trained to go to our legislators' offices, both at the state and federal level. So that just comes naturally. We are not trained to go into the EPA or HHS. And clearly there's a role for some advocacy directly there, but you've given us clearer strategies. I do think one of the things we've got to get better at the state and federal organized medicine and specialty society levels is breaking it down. So when we do our ledge days, there's actually rules that are important too, not just legislation. And then what are those strategies? Because there is a role for speaking with your policymakers on why the rules coming out of the EPA or HHS makes an important difference in the lives of my patients and practice. And so I think that's one of the ways to address your concerns of bridging all this work between our members, those that feel so distant from the work, but also how do we make sure that we're advocating for the right things based on what the experts are laying out for us.
One thing I'd add is that, and I'm less familiar with medical associations at the county level, but at the national level, the position statements that come out are incredibly important. It's a two-way street. We use those in our own advocacy, and I think that they're a really important way to engage members in actually learning the issues and understanding what's at stake.
Apologies, I know. Last thing.
Yes, so we have a question from Cynthia. It's kind of like two kind of questions in one. Let's see, is it more important to get more submissions versus more in-depth comments? E.g. quick voter voice comments versus in-depth individual comments? Are stories more important or more so, or are stories important in written comments or more so in meetings?
That's a really great question. And I'm curious to hear my colleagues' responses on the more versus unified voices. I've been really inspired by, so in my kind of realm in housing, the National Housing Trust took on organizing a lot of different perspectives and then submitting one comment on behalf of one organization. National Low Income Housing Coalition similarly does that. So getting at some of this burden question, that might also be an easier way to enter in, is to find organizations that are pursuing similar causes and join forces in submitting comment. I think different settings require different reactions. So for example, in many cases, my perspective is bringing evidence to bear, but that needs to be complemented by the individual stories. And so I think there's no one size fits all on what makes a compelling comment. And we need to hear both economic evidence, medical evidence, and other pieces to inform, as well as the real stories of who it affects. So I would say different people are positioned to do it differently, but there's no right way.
That's a great answer. And I would just add to that, one of the things that we've consistently heard from EPA officials is that they're looking for comments that highlight or point to medical evidence, data, research that is in support of the strong rule. So of course, what better messengers than the people who have the background and expertise to highlight that study, highlight that new research that shows us why we need a higher standard. Juanita also pointed out that that firsthand personal storytelling is extremely compelling. And of course, you all have that that expertise and personal story to share there too. But I would also say that it sort of depends on the rule. If the issue is more the timeline and not the substance, then I would say that pressure and number of comments is important. If the issue is that industry is doing everything they can to push back on the standard and weaken it, and EPA needs to see that public health professionals really think this rule is of critical importance, and if it's weak, it's a problem, then the substance of the comment is, I think, is what I would prioritize, like, you know, pointing to those exact studies that would be compelling to EPA. So depends, but that would be my answer.
Okay, so with that, time is up, but I did want to say, I'm guessing our panelists will stick around in case there are questions that still need to get answered, and we apologize we couldn't get to everyone. Let's give a big round of applause for our panel of experts, Juanita Constible, Dani, Hupper, and Sara McTarnaghan. Thank you so much.